I had a faculty meeting this morning. That's not affecting you guys or anything. It was just like training us on like features of Canvas. But then I have another meeting at 2. And so normally I have my office hours on Tuesdays until 2:15, but I'm gonna have to go to a meeting at 2. So I'll be a little bit early into those office hours. But I have the extra hours on Wednesday and Thursday where I'll be in the STEM. I'll be in the STEM not this Thursday, but on Wednesday instead. So if you wanted to come by on Wednesday or email me or Zoom or something like that on Wednesday, I will be doing my STEM lab hours on Wednesday from 2:30 to 4:30 and fitting all this. It's professional development week. So we have like a ton of trainings just like crammed into the week. And so we have to fit it into our schedule and everything. So this week got a little bit skewed from what the rest of the semester will be, but everything should be back on schedule next week. Before we get going with the Kahoot, does anybody have any questions about anything? Okay. All right, we're going to go ahead and get started with the Kahoot. This is going to be review over chapter 19, which was our skin and eye infections. All right, first question. Which skin disease is Staphylococcus aureus a common cause of the choices below? Alrighty, so this one's going to be impetigo. Scarlet fever is caused by Streptococcus pyogenes. Gas gangrene, that one is caused by Clostridium perfringens. And Fifth's disease is caused by a virus. We didn't really talk about which one, it doesn't matter. All right, true or false? Scarlet fever is caused by the measles virus. Let's see if you're paying attention to what I just said. All right, so this one is false. Scarlet fever is caused by Streptococcus pyogenes. Measles virus just causes measles. So scarlet fever comes when you have strep throat. It's like it advances into that. All right, what aspects of Clostridium perfringens causes production of gas in infected deep tissue? There's a certain feature about it that leads to its deep tissue infection, and the gas that it produces relates to its process. All right, so this is relating to the fact that it is anaerobic. This is an anaerobic organism, and when it gets deep into the tissues where it is not exposed to oxygen, then it is able to become vegetative and produce its toxins, as well as undergo its anaerobic respiration, where we have production of byproducts of gas. These are typically going to be H2S, which is dihydrogen sulfide gas. All right, true or false? Chickenpox is caused by a herpes virus. All right, so this one is true. Chickenpox is caused by a herpes virus that we refer to as varicella zoster. It's also known as human herpes virus 3. So it is a herpes virus. All right, next question. Smallpox is caused by vaccinia poxvirus. All right, so this one is false. Smallpox is caused by a virus called variola. So variola is the name of the virus that causes smallpox. We use vaccinia poxvirus. Vaccinia poxvirus is cowpox. We use it to vaccinate against smallpox because the immune system response will protect similarly. And cowpox is a much, much milder version. It's still a disease that you would never want to get. And it's still considered a pretty big concern if you were to get cowpox. But smallpox is much worse and has a much higher fatality rate. Vaccinia causes cowpox. Smallpox is caused by variola. Alrighty, what type of pathogen causes measles? And these questions that are on this Kahoot are very similar to the types of content that you'll be tested on for the Unit 4 portion of the final. All right, so this is caused by a virus. You kind of mentioned that earlier. It's the measles virus. Next question, what type of pathogen causes ringworm? Alrighty, so pathogens that cause ringworm are fungi, and most of us got this one, so we're pretty much aware of this. So those are called cutaneous mycoses, and the organisms that cause ringworm are called dermatophytes, but they are fungi. All right, your patient has a red eye with photophobia and milky yellowish discharge. What do you diagnose this as from these choices? Alrighty, so this is bacterial conjunctivitis. This is classical pink eye. Okay, next question. What is the most common infectious cause of blindness worldwide? Which organism is to blame? Alrighty, so this is going to be attributed to chlamydia trachomatis, which is also known to cause chlamydia, a sexually transmitted disease. It is a bacterial pathogen. And then this is the last question. Which type of organism causes river blindness? Okay, so this is caused by a helminth. So it's important to remember back to whenever we learned about eukaryotes in chapter 5. Protozoa are single-celled organisms. They are eukaryotes, but they are always single-celled. They're never going to be multicellular. And so this is going to be caused by the worm Onchocerca volvulus. So it is a roundworm and it is a helminth. All right, let's look at our podium and then we'll get into chapter 20. Chapter 20, we're going to be discussing the diseases of the nervous system. And I almost forgot, whenever I did my lecture yesterday, that this is going to include rabies. Don't we love it? My favorite topics to lecture on. Ironically enough, it is not one that I studied in graduate school. Okay, so great job, everybody. So let's move on with our lecture. Okay, so chapter 20, again, dealing with the diseases of the nervous system. First, we have to understand the basics of how the nervous system is structured. This is going to basically lead us into two major sections of the nervous system, the central nervous system and the peripheral nervous system. So the central nervous system consists of the brain and the spinal cord. Our peripheral nervous system, those are going to be the nerves that are leading off of that and into the extremities and the organs and everything like that. With the brain and spinal cord, again, this is your central nervous system, that your brain is going to be surrounded by the skull and protected by that. We also have the spinal cord that is being surrounded by the vertebrae, forming the spinal column. There's another layer of protection around the brain called the meninges. And it's actually important to remember that meninges is a protective covering around the brain and the spine, essentially, for the central nervous system. That the meninges consists of the dura mater, I know some people say mater, yeah, that's fine too, but dura mater, arachnoid mater, and the pia mater. Not going to get into the arguments of pronouncing the classical Latin words, but it wouldn't be said that way. That's fine. Cerebrospinal fluid. This is the fluid that fills the space surrounding the central nervous system. It is clear. It is sort of a little more viscous than water, but it's very similar to water, and it provides nutrition to the central nervous system. It's also an area where we would find white blood cells if we were having a response to an infection. It provides a liquid cushion for if we have an impact as well, so we're not just hitting brain up against, dead up against the bone. So it's cushioning there. And when we talk about meningitis here, meningitis is going to be, it says infection of the meninges, but itis always refers to inflammation. That's really important to remember. You can have inflammation of tissues without infection as well. So we're primarily going to be talking about meningitis as inflammation of the meninges due to infection. So that's mostly what we'll be talking about in our course, but itis doesn't always mean inflammation. It doesn't always mean infection. It's just referring to the inflammation. All right, the defenses of the nervous system. We have the bony casings, we have the cerebrospinal fluid that's going to provide the cushioning and the protections, like structurally and physically. We also have the blood-brain barrier. The blood-brain barrier is basically formed by the cells that make up the walls of the blood vessels. When we talk about how it's permeable in a lot of the tissues in our body, well, in the barrier between where we have crossover from the blood into the brain tissue, there's less passage allowed of molecules or larger structures, whether that's cells or even microbes or things like that. So this prohibits microorganisms from passing into the CNS, but it also can prohibit drugs or antibiotics from crossing into the CNS. So that can create a problem when we're trying to treat infections that are affecting the central nervous system. The central nervous system is also an immune privileged site. So anytime we have immune privilege, like we talked about with the eye, this is the case with the central nervous system as well. So we have a different sort of regulation of the immune response there, and it actually has its own setup of its own white blood cells, which will try to contain the infection on its own. We will have basically a decreased immune response in the area. That's because inflammation leads to tissue damage, and the nerves in the central nervous system can't regenerate. So once those nerves are damaged, it is permanent. Your peripheral nerves can regenerate to some extent, but even those can sustain permanent damage at a greater degree than what we typically might see in other tissues in the body. So we can't have inflammation causing too much damage to these structures because we need the structures in order to just live as organisms. So the cells in the central nervous system also have a lower level of MHC molecules to present antigen, simply because we don't want to be triggering too strong of an immune response when we do trigger it. We also have a lower amount of the complement proteins that we typically would see in the bloodstream. That once you get into the brain tissue, there's a lower amount of those. Again, we don't want to initiate membrane attack complex or inflammation or anything like that at a high degree that could lead to damage. So what happens in the central nervous system? They have microglial cells that are phagocytic. We have special brain macrophages that can help mediate the adaptive response so that it also wouldn't be too over the top. We can have lymphocytes migrating into the area, but it's going to be at a lower level, and they're going to basically be more subdued in their action. Generally, overall, the central nervous system and the peripheral nervous system itself will lack biota. So there's one other category that we'll be talking about for, we had the skin and eye diseases. Now we're doing the nervous system. Next will be our cardiovascular and lymphatic system. After that, respiratory, then digestive, GI stuff. And then we'll have the sexually transmitted diseases and other genitourinary diseases. But the central nervous system and the peripheral nervous system, as well as your cardiovascular and lymphatic system, they do not have biota. And so when microbes are present in that area, it's always due to pathogens being there. Whether they're opportunistic or true pathogens depends on what your immune situation is or how you're exposed. But we do not have natural biota in the nervous system or in the cardiovascular or lymphatic systems. We're going to get into our diseases. Some of these guys are going to be considered syndromes. And remember, syndromes are identified by the signs and symptoms associated with them, not by their cause. So when we talk about having the flu, that's always caused by the influenza virus. When we talk about having COVID, that's caused by COVID. Well, meningitis is basically defined by its signs and symptoms, which we'll get to in a slide or two. But it is an anatomical syndrome defined by its signs and symptoms. This may be caused by microbes, and the three major groups of microbes that can lead to meningitis will be bacteria, fungi, and viruses. And how they present meningitis, while we have the major signs and symptoms there, the progression of the disease is vastly different from those between those major groups. So with bacterial meningitis is much more serious than fungal meningitis, and fungal meningitis is more serious than viral meningitis. Viral meningitis is the one, if you're going to have meningitis, you want to have viral meningitis. Most people will recover naturally from that. We can also treat with certain medications if needed. But again, most people will recover on their own if you have an otherwise healthy immune system from viral meningitis. If you have bacterial meningitis, most people, if we do not treat you, will die from many of the bacterial meningitis. And so those can be pretty serious. So we're going to get into some of these in a moment. If you suspect that a patient has meningitis, there are 3 things that you're going to be doing. The first number one thing is start treating with broad spectrum antibiotics. I don't care if you think your patient is more likely to have fungal meningitis. If there's any chance at all that it could be bacterial, we want to treat it immediately because it can be that serious that quickly. And we're actually going to assume that it is one of the worst 2 and most common 2 types of bacterial meningitis. And that would be, well, we'll talk about it in a minute, but we'll treat for basically bacterial meningitis, any of the bacteria first. And then we will do, with your lumbar puncture, gather your CSF, your cerebrospinal fluid, do a gram stain on it directly, and then see what cells we see in there. So if we're going to be talking about bacterial meningitis versus fungal meningitis versus viral meningitis, if you take your patient's cerebrospinal fluid and do a gram stain on it, number one, there shouldn't be any cells in there, right? If you have white blood cells, it's because you have an infection going on. And you should be able to delineate, if you were a laboratory scientist, between the white blood cells versus the pathogen. So let's say you do a gram stain on this. And what you see is you only see white blood cells, and you see some larger cells that have nuclei and other membrane-bound structures like mitochondria and things like that. So if we had the choice between a bacterial, fungal, and viral, and we saw that there's a nucleus and there's eukaryotes, which one of those 3 could it be? There's only one. It would be fungal. Bacteria do not have a nucleus or any membrane-bound structures, period. We should know that by now, folks. So bacteria themselves will have a membrane, but they have no other membrane-bound structures. They don't have a nucleus. Do they have genetic information as DNA? Yes. Do viruses have DNA or genetic information? Yes, yes, yes. But they are not cells. They cannot multiply on their own. They're going to be using machines. So we need to go back quite clearly to Unit 1 and revisit these basic concepts of these pathogens before you guys get into the final. Because when you guys look at those questions that I sent out to you guys, or we have like the questions for each unit, and they're all like describe, explain, make a table or something like that. I'm never going to give you those answers. You're not getting the answers from me. You're getting the answers yourself, and you're going to answer them in your own words. If you look at that and you're like, yeah, that's too much work, I'm just going to go, then fine, settle with the same grade you've been getting on Unit 3 exam. Good luck with that. Because when I tell you that exam is worth like 13% of your grade or something like that, that's a pretty big portion. And so if you're willing to take that risk and take that hit to your grade, that's on you. But if you want to do more and be able to understand and apply, you need to be looking at those questions and answering those questions in your own words. If you get ChatGPT to answer the questions for you and you're just reading the answer and you're like, yeah, that makes sense. Good luck. Answer it in your own words. Figure it out for yourself. Explain it yourself. Because if you can't explain it yourself, you will not do well on the test. But I think we've gotten that far and we've kind of learned that. So be realistic with yourself. Be honest with yourself. Don't be delusional and lie to yourself and think you're going to do better on the final. Typically, my students have done better on the final compared to like Unit 2 and 3. However, they were using the study guide. You will not be using the study guide. There is no study guide for this final exam. Just like for Unit 3, it's the same situation. And you're not just going to get tested over the easy stuff. I'm going to ask you questions like, okay, well, if the patient walks into your clinic and they have a skin infection and, they're having, widespread exfoliative situation where it seems like they have flaking going on and it's going on all over their body and they've got these blisters happening. Well, what kind of pathogen do you think is causing that? And you might be thinking in your head, I memorized this. That's probably staphylococcal scalded skin syndrome. So it's probably Staphylococcus aureus. And if you can't tell me that Staphylococcus aureus is a bacteria, you're failing yourself. Don't just memorize the words and word association. You better know that Staphylococcus aureus is a bacteria. If you know it's a bacteria, does it have a nucleus? No. So if I were to ask you something like that, if you were to take a patient that's having that widespread exfoliative reaction with blistering on the body, and it's staphylococcal skin syndrome is what it sounds like to me, yeah? And I think that, oh, it's probably going to be Staphylococcus aureus, and I give you a choice. Your patient, when we look at the cultures from their skin, their samples in their culture, those cells from the pathogen, they do not have a nucleus. Is this consistent to the expected diagnosis? That might be the whole question. So you get me with this, yeah? We're talking about combining all of the knowledge from all of the units. You will have questions like that all over your final. Be prepared. You will not find the dead answers in your textbook, in my lecture slides, or anywhere else, unless you've done the work to be able to marry those things together. So that's what those questions are about. You don't do the work to try to work through all of those concepts and everything. You're not doing yourself any favors. Okay, so be prepared for that. So this is why I wanted to do this now, because we're talking about the gram stain, because all of these bacteria that cause these diseases, most of them can be like determined from one another just from a gram stain. Just from a gram stain, I can diagnose any bacterial meningitis that we're going to talk about today. And there are more than 2, let me tell you, like 6. And I could diagnose all of them just from a gram stain from the CSF, and you should be able to too. All right, so let's get into it. Meningitis is defined by the fact that you will have photophobia, which, despite the word, does not mean fear of light. It means sensitivity to light. So whenever you've ever been watching a dark movie and suddenly there's a white screen and it hurts your eyes, that's photophobia. It's light sensitivity. So that can be caused from situation, but it can also be caused from inflammation in the optic nerve or something like that, which is usually what's happening in meningitis. The inflammation is spreading and causing inflammation in the optic area as well. You might have headache, painful or stiff neck. Again, inflammation of the meninges and that covering of the nervous system, that stuff being inflamed will lead to pain and inflammation in those tissues involved anywhere in your nervous system. Fever is very common. You will also have an increased white blood cell count in the CSF, where we're not expecting to have white blood cells if you don't have any infection. And certain microorganisms would be attributed to certain characteristics, like our first one. Our first one is the number 1 worst one you will ever have. We're talking a 30 to 50% mortality rate. Okay, Neisseria meningitidis. So Neisseria is a genera. It's a genus. It's a genus of bacteria. Neisseria is sort of like we've talked about. Clostridium is a genus of bacteria, or Bacillus is a genus of bacteria, or Mycobacterium. It's a genus. Okay, so Neisseria is a genus of bacteria. They are all gram-negative diplococci, as it turns out. And so these gram-negative organisms, we have Neisseria meningitidis and another Neisseria that we're going to talk about in chapter 24 with our sexually transmitted diseases, Neisseria gonorrhea, different organisms, okay? But Neisseria meningitidis, you can even tell in its name, it's probably going to cause meningitis, right? And it is the worst kind of meningitis. This organism, we don't always call it Neisseria meningitidis. Sometimes we'll call it the meningococcus because they are cocci, they are round. They typically appear in diplococci. It's very characteristic of these guys. So they look like little butts all over the place. And that's just, I'm being honest, that's what they kind of look like. So these are gram-negative diplococci. So what color would they be in the gram stain? Red. Okay. So don't let me down, y'all. Okay. So, so they'll be red in the gram stain. So remember, gram-negative is going to be red. And if y'all think that ain't coming up on your lab exam next week, that's going to be on your lab exam next week. I'm going to expect you guys to know gram stains. You're going to know capsule stains. You're going to know endospore stains. You're going to know acid-fast stains. That's all going to be appearing again. Some of the questions will be similar to the ones that we had, but they will not be the same as the ones we had on the midterm. Okay? Some of them might be, because there's only so many questions I can ask about some of those things. But whatever. Okay, so meningitis, gram-negative diplococci. So we already know if we were doing a CSF gram stain, we would be looking for gram-negative diplococci. Easy enough. This causes the absolute most serious form of acute meningitis by far. It is responsible for about 14% of all cases of meningitis. So it's not a small number, especially when we consider there's like a lot of different kinds of meningitis you can have. Usually what happens is most people can harbor Neisseria meningitis in their normal like nasal cavities, sinus cavities. It's a normal part of your flora, but it doesn't belong in your brain. And so if it moves into the meninges through like the nerves or the soft tissues in the sinus cavities or whatever, and this is usually happening because your immune response isn't keeping it contained. And that might be because you have another infection going on, or you're getting older, or it's a particularly virulent strain or something like this that will be able to migrate from the throat, sinus cavity area and into the nervous system after that. So Neisseria meningitis has several virulence factors that can lead to the worsening of the disease, and it can progress into something called meningococcemia, which we're going to talk about soon, viremia, septicemia, bacteremia, and things like that. So when we say emia, you might even be thinking of something like anemia. So emia is referring to the blood. So when we have meningococcemia, this is the meningococcus in the blood. You do not want this infection to migrate into this blood stream. Look at this little baby. So because this is a gram-negative bacteria, we have endotoxin, and endotoxin will stimulate the inflammatory response. It's a very potent stimulator of your immune response. And so this will lead to damage pretty much systemically once you have a systemic infection. When you have meningococcal meningitis, meningococcal meningitis will be associated with a rash. It's the only one associated with a rash. So if you have meningitis and there is a rash, it's usually a petechial rash. It's from blood vessels bursting. And that's because we're going to have inflammation and reaction to the endotoxin on the bacteria, causing blood vessels to burst, because your capillaries are extremely frail and can rupture easily when we have that type of widespread inflammation. But if it spreads into the bloodstream, this will become a systemic issue. And the response to the endotoxin in the bloodstream can be one very similar to shock. We will have vascular collapse because we have damage of the blood vessels. We will have hemorrhage. We'll have red, purple lesions of petechiae and purpura all over the body. And here on this little baby, when we look at like the knee area there, that's going to be so much widespread damage. We'll have necrosis of the tissue as well. And so this can easily be extremely deadly very quickly. And it's very hard to catch up with it with antibiotics once it gets to that stage. All right, the body's ability to heal itself once it's had a certain amount of damage, and it's also responding to the inflammation and everything like that. It's going to be severely weakened with all of that response going on. So that is the meningococcal meningitis. This one is the pneumococcal meningitis, which I know you guys probably heard about, right? So this is Streptococcus pneumoniae. Already in its name, strepto, chains. These guys typically are going to be cocci that are found in chains. And guess what? Streptococcus, just like Streptococcus pyogenes, Streptococcus is a genus of gram-positive bacteria. So already I can tell you the difference between Streptococcus pneumoniae and Neisseria meningitis just with the gram stain. And that's it. And so Streptococcus pneumoniae, in its name, it suggests it probably causes pneumonia. You're not wrong. It is the #1 cause of communally acquired pneumonia worldwide. And we're going to talk about it when we get to the respiratory diseases in chapter 22. But we're not there yet. But Streptococcus pneumoniae also is the #1 cause of bacterial meningitis, the most common cause of bacterial meningitis over Neisseria meningitis. It's still a high mortality rate, but it's less than the meningococcal version. So this is going to cause the majority of bacterial pneumonias and the majority of meningitis cases, bacterial meningitis cases. This one does not have a petechial rash associated with it. It doesn't have endotoxin. It has other toxins that will allow for it to move basically from wherever you're harboring. Again, same natural like location in your body. You can have this as part of your flora, just like you can the meningococcal one. But the pneumococcal one will usually exist in, again, same place, sinus and throat area, and then migrate into the meninges the same way, or it can migrate down into your lower respiratory tract and lead to pneumonia. It doesn't belong in either of those places. So when we have a shift in our biome, a shift in our immune response, or we might have another infection going on in our bodies that'll make you more susceptible to this spreading. It's a pretty common component of your biome and your respiratory tract. It's more common in people with lowered immune systems, but that doesn't mean that you aren't, going to get it. It's not 100% guaranteed. It is a small gram-positive coccus. It usually has end-to-end pairs. Again, we're going to have chains of these guys, okay? And this has a capsule that protects against phagocytosis, like a lot of the streptococcus guys do. It also has an alpha hemolysis, so this is not beta hemolysis. This is alpha hemolysis. This is the green, right? So before we get to beta, the complete hemolysis, we have the partial hemolysis. So we could grow this also on blood agar and look for that partial hemolysis that would allow us to differentiate between Streptococcus pyogenes, which has beta hemolysis, okay? So we would be able to do that without ever having to do PCR or anything like that, just by growing it on some blood agar. There are vaccines that are available for the pneumococcal one. Next is Haemophilus influenzae. It's still in the bacteria, okay? So this is our third bacterial cause of meningitis. This is also known as Hib. This guy is a gram-negative coccobacillus. This guy is not a diplococcus like Neisseria is. So already in the gram stain, I can differentiate all three of these guys. We have the meningococcus, which is the diplococci. They are gram-negative. We have the pneumococcus. The pneumococcus is going to be chains of gram-positive cocci. And this is a coccobacillus, oval shaped. And they're not going to be diplo or anything like that. They're just going to be existing in random groups. No arrangement on these guys. So this is Haemophilus influenzae. We also call it Hib. There is Hib serotype B and serotype A, and B is the more common version, but it can lead to meningitis. It's more common in people who have lowered immune systems, and vaccination has significantly decreased the risk for this guy. Next, we have Listeria monocytogenes, gram-positive. This guy has a sort of range of morphology. Is typically going to be coccobacilli, but it can be like long filaments of bacilli as well. So typically a bacilli for this guy, and this guy is gram-positive. Haemophilus influenzae was gram-negative. So I can tell the difference between our bacilli too in my gram stain. So this guy doesn't have any capsules or endospores, but it is motile. It has flagella. It's not fastidious. It doesn't need any special growth factors. So it's pretty wide in its range and ability to grow in certain places. It's resistant to cold and heat, and to salt, and to pH extremes, and to bile. So it can survive in your GI tract, and that's usually how you get exposed to it. This is a foodborne illness. And so it moves into your GI tract, and you might have some, general feeling of unwell, as well as GI symptoms. And then usually most people will clear it out pretty naturally. You might be sick for a couple of days and clear it out, but it can cross the placental barrier. And that's where the bigger risk comes from. These guys live inside of cells. So most bacteria live outside of the cells. These guys can migrate into the cells and then can move from cell to cell within the cells without ever leaving the cells. And so this guy can be pretty invasive and cause a lot of diseases. Listeriosis is the overall disease associated with Listeria monocytogenes. And listeriosis can lead to the development of meningitis. Most of the time, most people get a fever, diarrhea, maybe a little bit of a sore throat. This guy can disseminate through a lot of tissues in the body. It can cross the placental barrier, and it will cause premature abortion and death. The death rate is about 20% in that sort of situation. It's associated with contaminated dairy products, poultry, and meat. Have you ever heard about pregnant women supposed to microwave their lunch meat? This is the reason why. Because 20% abortion rate caused by this guy. You don't want to have carried your baby, have yourself a nice little sandwich where you didn't heat up your deli meat, and then end up losing your baby as a result of that. That would be a huge risk. Now, food testing usually tests for this, but that doesn't mean that there are safe practices in the places where the food preparation is being handled. So you want to keep that in mind. All right, neonatal and infant meningitis. So babies that are being born are at risk for different kinds of bacterial exposure. The main causes of this type of meningitis is going to be Streptococcus, again, Streptococcus. This is Agalactiae or E. coli. So when we talk about group B strep tests for women who are pregnant, the strep test that we do when you are pregnant, we'll do a swab of vaginal canal nearing the end of pregnancy in the 3rd trimester, and then see if you in your vaginal canal harbor any streptococcal bacteria. If you do, if you're positive for that strep test, we will treat you with drugs to try to clear out your biome, your natural biome. 40% of women harbor this strep bacteria in their vaginal canal. It's extremely common. And so we want to be sure we're eliminating this threat, because as the baby's being born through that birth canal, bacteria can get in through the eyes or the mouth and then migrate into the nervous system and cause meningitis, which is extremely dangerous for the little babies. They don't have their own immune system of their own in order to fight that sort of infection off. And it can be deadly, but also it could cause permanent defects as well. So I even had a student of mine in the previous semester who her baby got strep by vaginal exposure during birth, and then wound up having meningitis as a result, and then lost his hearing later as a result of the meningitis. And that was permanent hearing loss. And then ended up later on, due to the complications caused by the strep infection, wasn't able to fully recover and ended up dying. So this is something that happens like to people, like not uncommon. So if you're thinking of working in a neonatal sort of environment, expect to see this, and then understand the importance of treating that prior to birth. Yeah. And we can do a swab of your vaginal canal and it might come back negative. That doesn't mean that you didn't have that in your body. It just means the swab didn't catch it. And so that's where the other risk can come up. You can also, maybe your first pregnancy, have the swab and it'll be positive and we'll treat you with the drugs, and it can completely clear it out of your flora permanently so that your second pregnancy, you might not have it. Yes.
So what can they not do for it?
So the problem with it is that it clears out your other natural biome and flora. So it might make you more susceptible to other infections. So that's why they'll usually wait till the third trimester and then treat you like when your birth is coming up, and then hopefully clear that out ahead of time. It's usually common practice to test for that, but again, not everything is 100%, fail safe. So that's the problem. Yeah, so well, people just this is the type of thing that just happens when you're pregnant, and most people don't know what's going on or why it's going on. Now you guys will know, you'll be educated for it. So moving on. So that's all of the bacterial ones we're going to talk about. So those were, we talked about the meningococcus, the pneumococcus, Hib, and Listeria monocytogenes, and the characteristics of those diseases and kind of how you're going to get those. Now we're going to move on to the fungal ones. The fungal meningitis, these are usually more chronic in nature. So they're going to be less severe symptoms, and these are caused by fungi. The first one is Cryptococcus neoformans. It's widespread in human habitats. It's usually spread via bird droppings in the area. And so that can be like when you're sleeping or something, you could be disturbing these spores from the fungi that are in the bird droppings. This is actually really common in homeless people and people who have HIV because they are immunocompromised. So keeping that in mind. Immunocompromised patients will have a fast onset. They usually have an acute version of the disease as opposed to the chronic one. And it'll be much more severe and can be deadly. So HIV predisposes you to having that. All right, or being susceptible to it anyways. Coccidioides. So coccidioiditis is a fungal infection caused by Coccidioides immitis, which is a fungus. And it doesn't always present with meningitis, but it is a possibility to have meningitis, but usually has other features involved in this guy. This is not super common. It's usually found in Arizona, in the deep Southwest, in drier climates. Coccidioides is the fungus. 60% of cases will occur in Arizona. It's not a very common one, but it is one possible cause of fungal meningitis. Next is the viral meningitis. That's it for bacterial and fungal. Now we're into viral. So 4 out of 5 meningitis cases are caused by one of a variety of viruses. So most meningitis cases is telling us, most meningitis cases are going to be caused by viruses, 4 out of 5. So that's pretty important to think about whenever we're talking about like the frequency of meningitis. You're more likely that it's going to be caused by virus. And the good news with this is that viral infections are generally milder than bacterial or fungal. They usually resolve in 2 weeks on their own, and the mortality rate is less than 1% for these guys. So if you're going to have meningitis, have viral. So if we did take your cerebrospinal fluid and we looked at a gram stain of it and we didn't see any cells, maybe we see your white blood cells, but we don't see any pathogen in there. but we're pretty sure they have meningitis, and this person has a fever, and they've had symptoms maybe of illness prior to that, then it's probably viral meningitis. We call it aseptic meningitis. And this is because you will not see any bacteria or fungi, because you don't see viruses in a microscope. It's either probably going to be that. So if you have meningitis and we do look at your CSF and it is clear, most of the time, the majority of viral meningitis cases are going to be caused by enteroviruses. So these are viruses that get in through ingestion and then they migrate into the nervous system. This is actually how polio operates. Polio doesn't cause meningitis, causes an encephalitis and like a muscular nervous system issue. But polio, dealing with the peripheral nervous system more, but it is an enterovirus. It gets into the gut. And so you're exposed usually by ingesting it. And you know, little kids going around, they're not washing their hands, they're putting their hands in their mouth all the time or putting weird things in their mouth. So usually 90% of the time in children going to be caused by enteroviruses. And these are just like all over the place. And so we might attribute it to a specific virus, but more often than not, we're just going to monitor the child over time and just make sure that the disease isn't progressing to a state that will become damaging. So it's typically what we're going to do is monitor. There are drugs that we might give if we suspect it might be associated with something else. Herpes simplex virus is also known to be associated with it. And there's other herpes viruses like human herpes virus 6, 7, and 3. If you don't remember, human herpes virus 3 is varicella zoster, chickenpox. So chickenpox can be associated with developing meningitis as well. And not surprising because herpes viruses live in the nervous system. And so if it can affect the nervous system, it could potentially cause inflammation of the meninges, and that is what meningitis is. And so these guys can be associated with developing meningitis as well. The genital one, typically. So now I want to be clear about this. You can get HSV1 in the genitals, and you can get HSV2 as oral herpes. So they can cross over. It's just primarily most people that have the oral, what we consider cold sores, and almost everybody has had it at some point in their life, is HSV1 typically. And then HSV2 is typically the sexually transmitted version.
So I just have like a really easy question.
Yeah.
Is there a way that like, I know you can differentiate with certain tests. Is there a way for them to differentiate like whether it is like which one it is or?
So PCR is usually going to be used for that one, yeah. So if they're going to be treated the same, so if you had like a genital herpes, we're just going to give you, Valtrex to treat it and treat whatever kind of herpes virus is in order to deal with that. And so usually we don't need to delineate between the two when we're treating the patient, but we might want to delineate between the two if the treatment wasn't working well for some reason, or if like your patient has some sort of immune compromised situation where like they're constantly having a herpes outbreak of some kind. Sort of like whenever you guys have seen like the wart man, right? You guys seen the guy that's like, they call it the human tree or whatever, but he's like basically covered in warts, like completely. And those, they say he develops horns, but it's literally just keratinized skin cells from HPV growing out of control because he has a dysfunction in his immune system that doesn't keep that infection at bay. And so you can have that happen with a lot of different viral diseases, including herpes. So if there was some sort of issue going on there, then we might want to do PCR to delineate between HSV1 and HSV2. But otherwise, we're usually not very concerned about it. Yeah. All right. So again, viral meningitis, you won't see any cells from the pathogen, and it's usually going to clear up on its own in a couple of weeks. Moving on, so that's it for the meningitis. We're going to now go into the in-between category, which is meningoencephalitis. And then after that, we'll do encephalitis. Meningoencephalitis, you will have inflammation of the meninges, and the encephalitis part is the brain tissue. So this is inflammation in both. This is typically going to be associated with amoebas. Amoebas are protozoa. So these are eukaryotic guys. And amoebas, again, they move by pseudopodia, the fake feet. They just extend part of the cell out and it adheres to a thing. It's also used for them to eat things up. And the two amoeba causes of meningoencephalitis are going to be Naegleria fowleri and Acanthamoeba. These are the brain-eating amoebas. The first one is Naegleria fowleri. It's flask-shaped. I'm not going to ask you about that on the test, but it is used for identification of it by laboratories. Infections are usually going to be reported in people who are exposed to like warm natural fresh water. So this is usually ponds and lakes and swimming in warm pond and lake water. And usually what happens is it's hard to get this. It's like super rare to, we've only have like, 30 cases or something in 10 years or something like that in the whole like United States. So it's really not very common. But what happens is people jump into the water, it forces the water up into the sinus passages, and then the amoebas are able to cross the blood-brain barrier and infect the meninges in the brain after that. And so it doesn't happen super commonly, but it does sometimes enter the nasal passages that way. So this Naegleria fowleri is going to be the cause of PAM. And so PAM is primary amoebic meningoencephalitis. And so you do need to know the differences between PAM, and that it is caused by Naegleria fowleri, and GAM, which we'll talk about in just a second, which is caused by acanthamoeba. So they're two different amoebas. They cause two different versions of amoebic meningoencephalitis. Okay? So PAM will cause rapid destruction of the brain and spinal tissue. It's rare, but if you have it, treatment is pointless. It is 97% to 98% fatality rate. And if you were in the 2% that survived, you almost certainly are going to have neurological deficits afterwards. Between 2011 and 2021, 29 people were infected by swimming, like in lakes and ponds and things like that, typically. One person was infected by contaminated water on a slip and slide, and 3 were infected using neti pots. So if you are using tap water, and I'm not saying if you're using a neti pots are great, especially during allergy season, but use distilled water from like a jug that you buy at like Walmart or something like that. Use distilled water. Do never use tap water. Yes. So yeah, I have that too. And like you have a little tap at the water, like you usually have one at like the sink or whatever. And that's the filtered water that's like extra filtered. So that should be fine because it'll filter out most things. But even me still, I would probably boil it. So if you're gonna do what I do, so I use tap water if I do a neti pot, but I boil it first. If I just like put it in a mug and microwave it until it boils, then I let it cool down a little bit. And then I make my neti pot water out of that because I don't buy distilled water every time when I do a neti pot because I don't do it often enough to just have distilled water around for that. So it is fine. And that would be even safer because then you would know for sure, like, you don't have to boil it for 30 minutes necessarily, just boiling. Like I just do it that way. And plus it needs to be warm to your body temperature. It's a lot more comfortable with body temperature. Just trust me on this. So yeah. I mean, I've told you guys, I've had fungal sinus infections that I've had to have surgery for in the past. So I don't play around with that anymore. When I start getting like any sort of like sinus issues, I'll do neti pots just to make sure everything's cleared out so I don't have to ever do that again. But you do want to, if you do a neti pot, be sure you're getting like the little packets of salt, and it usually has salt and sodium bicarbonate in it, and that'll make it pH of your body and isotonic with your tissues, so you're like still being healthy, nice moisturized sinus passages instead of like having an isotonic or a hypotonic or hypertonic situation. You want to be sure it's like isotonic. So FYI if you're doing that, but boil the water or use distilled water. All right. Next is acanthamoeba, another cause of amoebic meningoencephalitis. This one causes GAM. And again, you guys won't have to write it out, but be able to recognize on the test. Granulomatous amoebic meningoencephalitis, GAM. And so granulomas are like when your white blood cells try to wall off infection, it creates these structures that we call granulomas that you would see in like tissue biopsies and things like that. And that's what this is defined by. So granuloma is caused by the white blood cells trying to wall off the infection. Again, these are amoebas. So these guys will invade broken skin, your conjunctiva, lungs, and urogenital epithelia. So this guy, when we talked about it causing keratitis, which is the infection of the cornea, because we were using tap water with our contact lenses, can then through the conjunctiva invade into the meninges and the brain, and then cause meningoencephalitis this way. Again, 97 to 98% mortality rate. It's just as fatal as the other one, just a slower progression of the disease, and really no treatment for this. So if you do get meningoencephalitis from this guy, then it's a death sentence, really. All right, uncommon, really rare, but still, wash your hands with soap and use sterile solution to rinse your contacts off. Don't use tap water. All right. And again, RO water, probably going to be less likely to have this situation for sure. But the problem sometimes isn't always with like the water itself, as much as it can be the microbes that are in your pipes in your house, right? And so that even RO water can't really protect too much from what's in your pipes in your house, unfortunately. Let me tell you, because I live in Bethany and I know. All right. Acute encephalitis. So moving into encephalitis, this is not with, it can involve meningitis, but the pronounced aspect here is going to be the brain inflammation here, all right? So it's almost always caused by viruses, almost always viruses. Signs and symptoms, you're usually going to have like neurological effects in the brain. So you'll have behavior changes, confusion, decreased consciousness, seizures, and you might have symptoms of meningitis as well on top of these things, but it will be pronounced by the effects of the encephalitis. And we usually will treat these guys if we're going to treat them. Most of the time, people can recover from this stuff too. But if it gets into the serious, if you start actually having encephalitis, we will treat it with acyclovir. All right. Most of these encephalitis, a lot of it is going to be caused by the arboviruses. And so arboviruses are viruses that are transmitted by insect bites. And there are a lot of arboviruses. Some of them cause encephalitis. So the ones with encephalitis is the ones we're really referring to here. So they are transmitted typically by mosquito bite, but they could be transmitted by other bug bites as well. And the ones that you're going to be most familiar with, things like West Nile virus, Zika virus, and things like that. There are some other ones worldwide that are much more deadly, especially when we're talking about something like equine encephalitis virus, which has something like a 50% mortality rate, but it's extremely uncommon. You really don't see it a whole lot. It's equine, so it's maintained within the horse population. And it's just as bad for horses to get it as it is people. And it's something that people with horses that they keep outside in mosquito-ridden areas will be looking out for. It's usually a death sentence for the horses if they do have it. There's not much we can do for them past a certain point, but yeah. All right, so it's maintained within warm-blooded like mammals in general, and it can be transmitted between most mammals. So it's maintained in animal populations, and most of these are going to be zoonotic diseases. This is a list of arboviruses. Some of them are associated with encephalitis. Some of them are associated with other diseases, but if it is transmitted by insect vector, then we consider it an arbovirus. So here are some vector species that are over here. When we look at mosquitoes like Aedes species, we have Aedes and we have Anopheles and we have Culex. There's all these different kinds of mosquitoes, and I hate to break it to you, but we have most of them in the United States. So Aedes and Anopheles and Culex, we can harbor most of these diseases here in the United States. Some of them we have, and some of them are migrated. They're like new emerging diseases in the United States, and some of them exist just within the United States. But we already know that, like, if you look at something like West Nile virus, which is down here in the flavivirus category, West Nile virus is transmitted by Culex mosquitoes. We also have Aedes mosquitoes, and the Aedes, which is these ones over here. We know we have Zika. Zika is transmitted by a different kind of mosquito. Zika is transmitted by Aedes. West Nile virus is transmitted by Culex. So if you guys ever notice, like when now it's getting mosquito season, right? We're getting into some mosquitoes coming out. And right now it's usually the big ones. The ones that are like a little bit bigger and they have like a golden butt to them. I don't know how to describe it, but they have they're mosquitoes. They're a little bit bigger and they still bite. They have a golden butt. But then later on in the season, you'll see them littler guys. And if you look at them real closely, they're black with white stripes. Those are different species of mosquitoes. And so that's what this is talking about. You think of them as mosquitoes, there's all these different species, and each species can harbor different diseases. Mosquitoes are the worst, and let's get rid of them. I'm on board with you with this. Yeah. It's a tick disease. So that is going to be considered an arbo. It's a Rocky Mountain spotted fever is caused by bacteria, but it's an arbobacteria, you'd say. It's not arbovirus, right? So it'd be arbobacteria, but yes, it is transmitted by a biting insect. Yes. All right, moving on. That was it for those guys, but we still have other guys that are associated with encephalitis, and that can be herpes. So we talked about herpes can lead to meningitis. We talked about it being associated with viral meningitis, but it can also be associated with viral encephalitis as well. So herpes virus, herpes simplex viruses 1 and 2 can both be attributed to encephalitis or to meningitis, or both. And so a lot of times, most of these are going to be caused by herpes simplex virus one, getting transmitted from oral into maybe the eye and then migrating into the nervous system. Or in the case of babies that are being born to mothers that have herpes virus, herpes simplex virus 2, the genital version. So if you're having an outbreak in the genital region and you are about to go into labor, it's actually against the law to deliver that baby vaginally. So this is because of the risk of infection to the baby. So if you're having an active outbreak of HSV2, you are not allowed to give birth vaginally. I don't care what your birth plan is, because if the baby is exposed to herpes simplex virus 2, genital herpes, during the birthing process, while you're having an outbreak. If you're not having an outbreak, you can give birth vaginally. The risk is super low that that'll get transmitted. But if you're having an outbreak, then we will not allow you to give birth vaginally. You will give birth by cesarean section. That is because if you're exposed to HSV2 during the birthing process, it can get into the eyes and it will infect the baby through the skin and things like that. And that might just cause herpes. But I hate to remind you, herpes is forever. That baby will always have herpes forever. And so from birth, it will have herpes. So there's a risk of that. That's bad enough as it is, having herpes anywhere on the body and then being disseminated typically in widespread areas of the body through exposure from birth. However, the bigger risk, and that can itself lead to issues that can lead up to like maybe 30% mortality rate just from having herpes as a baby. We don't have an immune response to keep it under control. However, if it gets into the eyes, which is not uncommon during birth, then it can spread into the brain and lead to meningitis or encephalitis. Now we're talking an 80% mortality rate. That is why people with herpes that are having an active outbreak cannot give birth vaginally. All right, Zika virus. We've heard about it. Most people will get very mild symptoms from having Zika virus. You might have a range of neurologically related symptoms or just like illness, like fatigue and malaise and things like that. You might have a rash, you might have conjunctivitis, you might have muscle or joint pain. It does seem to trigger Guillain-Barré syndrome. So we're having issues with the peripheral nervous system there. Pregnant women, it can cross the placental barrier and affect the developing fetus. It is not uncommon for Zika virus to lead to microencephaly of the fetus. This is where the brain and the cavity, the skull and everything will be too small. And so this will lead to developmental issues for the baby issues associated with mental capacity and things like that. So it can also cause vision problems, lead to permanent neurological issues like involuntary movements, seizure, irritability, and these could be lifelong. It's not super common to see symptoms in adults that have Zika virus that are long lasting. It can happen, but the bigger issue is going to be with the babies. All right, moving on to rabies. Rabies causes what we call rabies encephalitis. So it's a slow and progressive zoonotic disease. For humans, this encephalitis is going to be basically happening over 1 to 2 months of progression. So from exposure, you won't have typically any symptoms until about a month or two after exposure. So it's a very slowly progressive thing. It's not something that happens within a couple of days after exposure. There's 2 versions of rabies, furious rabies and dumb rabies. Now, furious rabies is where the danger comes from, and rabies can infect any mammal ever. So the reason why we think that like possums can't get rabies is because they have a lower body temperature. So the body temperature affects the ability of the virus to replicate in certain cells that allows it to migrate within the nervous system and everything. And so we think that possums, because they're marsupials, they have a lower body temperature. So we think that that might be why they don't get rabies. Like, you're not going to see it. That's not a never thing. It's extremely rare for a possum to have rabies. They'll have other diseases though. So I'm just saying.
Sorry,
Yeah, they're still gross. Like still can be anyways. I think they're really cute. Don't get me wrong. I love a possum. Yes, I love a possum, and they come in my backyard over by the lake all the time. They eat ticks. They eat, all sorts of, insect pests around your house, and all sorts of stuff like that. So I think that a possum is a good thing. Don't get me wrong, but that doesn't mean handle it and cuddle it and bring it into your house. Yes. So please, yeah. Anyways, rabies. So furious rabies and dumb rabies. The classical presentation of what we think of when we think of rabies is the furious rabies. We'll have agitation, disorientation, seizures, twitching, all of this caused by neurological effects of the encephalitis aspect of the disease. And we have something called hydrophobia. Hydrophobia is because there's a neurological thing going on where you can't physically swallow, and actually will cause like anything that touches the throat a reflex response to violently like regurgitate it. And so you can't swallow things typically once you have rabies. This works in favor of the virus because the virus once it gets into the nervous system will also migrate into the salivary glands and multiply in the salivary glands. So if you can't swallow the saliva, you have all this rabies virus filled saliva, and then you've also got agitation, and you go bite as an animal, go bite something, and you just spread the virus around. So it works to the advantage of the virus to have all of these things going on, including that hydrophobia, which isn't fear of the water, it's just your inability to swallow it, as well as the saliva. And that's why we see the foaming at the mouth that's associated with that. It's just can't swallow the saliva, so it just collects in the mouth and that way. So that'll happen with animals as well as people. Dumb rabies is what happens when we have paralysis, disorientation, and stupor. So these people or animals aren't going to be spreading the disease. There's not as much risk with that spreading that way, but it will spread through the furious form. Both of these phases, no matter which phase you end up with as an animal, death will always result due to coma. You'll slip into a coma and then die from the respiratory and cardiac systems failing from the nervous system failure. Right. Yeah. Yeah. Yes. It can be a week to a month. It just depends on the patient, really. It's usually not super long, right? So I say most people will die within a week or 2 weeks. Yeah, once you start having the symptoms, like from the initial onset symptoms to death is usually a week. 2 weeks is, I feel like, stretching it a little bit. Yeah. So rabies, we have a bullet-shaped virus. It has an envelope. So we've got glycoproteins on the outside of the envelope, and on the inside we have a helical capsid with the nucleic acid all like wound up inside of it. That's the structure of the virus. And about a month. Well, for humans, it's about a month. Yeah. Mm-hmm.
But until I read something that they are not, like the saliva can't carry it until after the symptoms that there's been.
Yeah, so it'll move into the nervous system first. And you'll always, because of the progression of it, you'll always start having at least some symptoms before it's even in the saliva. So that salivary presentation doesn't come necessarily first. They'll all come kind of at the same time. And so you won't have signs. If you have rabies, you will usually have signs and symptoms, and then it would be in the saliva from that point. Yes, you have a question?
If you're not treated before you start showing signs and symptoms, it's basically
100% fatality rate, yes. If you don't get the treatment before seeing the signs or symptoms of rabies, you will die. There's no signs or there's no treatment for animals, okay? Only for people. And this is going to include immunoglobulin infusions as well as administration of prophylactic vaccine. The vaccine is administered into the gut in that situation because you have most of your lymph nodes and lymphatic tissue is in your gut. So we're trying to get it to that site and start the lymphatic, like your lymphocytes reacting to it as soon and quick as possible so that you can mount your own immune response and curb it from spreading out of the peripheral system and into we don't want it to get to the central nervous system because once it gets there, you're done. So we can stop it from getting to that. It's slow enough that if we catch it early enough, we can get the immune system working in your favor. And so we use immunoglobulin from like antibodies from people that have had rabies previously and infuse you with that. And that'll give you some protection to slow it down while you're building up your own. And then hopefully you wouldn't get that. If you get the rabies vaccine as a vet tech or as a veterinarian, OSU OKC requires our vet tech program to have rabies vaccines. You don't get it in your gut when you get it that way. You'll get it the normal way. Like we can let your body normally build up that stuff. There's no rush with that. So that is, but the vaccine, when you get it as what we call prophylactic treatment, post-exposure prophylaxis is what we call it. If you get that, then that is going to be administered to your gut. It's extremely painful treatment. So anyways, it's maintained in the mammal population. It's very common in Canine populations in the United States, domestic dogs don't carry it typically, but cats do. People just let their cats roam around. They don't typically vaccinate them regularly. So cats are pretty commonly can be found with rabies. So just be careful if you're picking up a stray cat. Like if it seems aggressive, do not handle it if you can help it, and maybe call animal control about that. It'll be better for the animal to have it put down before it has to suffer through dying from rabies. It's estimated that there are about 35 to 50,000 human cases worldwide every year. In the United States, we have 6,000 to 7,000 animal cases per year. We've also had transmission of rabies through donated organs, including through corneal implants in the United States. This has happened. So you can get corneal implants from deceased people. They don't have to even be like alive organ donors. Deceased people can have like from dead bodies because we don't have to keep the cornea alive for it to be viable tissue. And so somebody had died and they didn't know they died from rabies. And but apparently they had. We found out afterwards because the person that received their corneal implant ended up getting rabies and dying from it. So yeah, that happened in real life. So gotta love it. So here are the common carriers of rabies in the United States. You see here in Oklahoma, the primary carriers are going to be skunks and bats. So if you have bats that are living in your house or near your house, you might want to be mindful of that. And skunks, if you see them wandering around in human habitats, especially in the daytime, be very wary of that. Do not contact, not that we would be going up to a skunk, but hey, say it. And so for treating and preventing rabies, we want to, for humans, as soon as we think you've been exposed, we want to get treatment underway before the symptoms develop, because once the symptoms develop, it is 100% fatal. So we will use post-exposure prophylactic immunization for that in people, as well as immunoglobulins. Vaccination is imperative for domestic animals, so please vaccinate your animals, especially for rabies, preferably for all the other diseases that could be available and that your pets could be exposed to. Anybody that's handling animals on a regular basis will also be vaccinated typically, especially if you're going to be handling what you might consider could potentially be rabid animals. There are vaccine programs where we drop bait into certain areas to do that. So there are some videos about rabies in animals and in humans. There's a video about a human that died of rabies down here that I'm not going to play, but I am going to play the video of the cat that has rabies so you can see what it would look like. So this is a little cat. That is exhibiting kind of classical signs of later stage rabies.
This cat is fairly nice, fairly normal.
So watch the cat try to ambulate. You'll see that it's kind of disoriented, unable to move properly. This is a sign of a neurological issue, and the aggression is also part of what we consider to be an issue with rabies. Anyways, so you get the idea with it. So you would have to euthanize that animal. And with animals that that are showing signs of rabies like that, the really only thing we're going to be doing for them would be euthanizing them. And it's expensive to test them. So typically in situations like this, we're just going to assume that that animal had rabies. Yes. So yes, there is no test for rabies in a living animal. It is like you have to get the nervous tissue. All right, so moving on, polio. This is an enterovirus that gets in through ingestion and moves into the nervous system after that. It was spread through water typically, and so it was in the water system. And so people were getting it very commonly for a while. It causes fever, headache, nausea, sore throat, and myalgia. What does that sound like? The flu? Yeah, any basically flu or cold-like illness, it starts that way. And then we would have progression into the neurological aspect. It will infiltrate motor neurons. So we're talking the peripheral nervous system here, and affect those neurons, and then can move into the central nervous system after that. So it can cause a paralytic or a bulbar version. In the paralytic aspect, we're going to have basically paralysis that can become progressive. So we'll have the extremities affected, and then it can progress further into the body. It can affect the legs, abdomen, back, intercostals, diaphragm, pectoral girdle, and the bladder. And so as the paralysis progresses, we would have to put people into the iron lungs, and the pressure changes in the actual apparatus would force the body to take in air and exhale air, because their diaphragm couldn't do the work for them. It was forcing that for them. Bulbar poliomyelitis is where we have affected the central nervous system. And again, we'll have loss of control of the cardiorespiratory regulatory centers. This is usually going to be a fatal situation there. Then we have post-polio syndrome, where damage is done to the nervous system and can continue to progress even after clearing the virus and recovery. So 20 to 50% of patients will have post-polio effects that can progress and worsen after. No. So this is the shape of the virus. It's just a capsid and nucleic acid, and that's all it is. It doesn't have any other, doesn't have an envelope or anything else like that. It's one of the smallest and most basic viruses that we know of, and yet causes one of the most horrific and horrible diseases that ever existed in mankind. It gets in again through ingestion and then moves into the nervous system. Humans are the only reservoir. Animals cannot have polio. It's not carried within animal populations, it's maintained in people. And so we had vaccines that were developed that were incredibly effective and has basically eradicated polio, except in Afghanistan and Pakistan. There are still populations that still have polio there. So we're working on vaccine efforts to eliminate it, but it's likely that we'll see polio eliminated from the planet in our lifetime, just like smallpox was. So we're moving on to our subacute encephalitis diseases really quickly. Toxoplasmosis, measles, and prions. If you have measles and it's not clearing up, it can lead to subacute encephalitis, and that can progress to death eventually. 6 million people a year, just reminding you guys. Yeah, so Toxoplasma gondii. This is extensive. It is worldwide. It's all over. It's maintained in the feline population. So cats have this naturally and typically don't have any signs or symptoms of it, and they can carry it. In fact, it's pretty common for cats to carry this. There are tests that can be done to test for toxoplasma, but we typically don't test for it. We just assume the cats have it. And so if you are pregnant, or if you know somebody that's pregnant, this is why we tell people not to handle cat litter. So most of the time, we're going to have an asymptomatic situation. You might have sore throat and lymph node enlargement and a low-grade fever. Almost everybody that's contacted the cats regularly at some point has probably had this and cleared it out of their body naturally. It's not uncommon for an infection with this to lead to risk-taking behavior. And we might not point that out when people or see it. We might just think that they're acting like taking more risks. But in mice that get this disease, they'll take risks and like put themselves at risk for getting eaten by the cats, and that's what helps keep that protozoa alive. This is a protozoal infection, Toxoplasma gondii. Yeah, so it can lead to a chronic or subacute encephalitis in people who have immune system disorders. This is something that can lead to death in people that have AIDS. It's not uncommon for somebody that has AIDS, if they have a cat that has toxoplasma, that they could die from toxoplasmosis easily. There's a 33% chance that if you become infected, that it will spread to the fetus if you're pregnant. So 33% chance of the mother transmitting it to the fetus. If it does transmit to the fetus, in the first or second trimester, it can be associated with stillbirth, liver and spleen enlargement, liver failure, hydrocephalus, convulsions, damage to retina or blindness, and can lead to permanent defects.
From the feces, or is it like a bite as well?
Yeah, it could be a saliva and things like that potentially. It's just more common in the feces and can be spread mostly to the feces and the urine as well. So yeah, just more concentrated there, and then the dust from the litter, it just gets into the air. All right, prions. Prions are just misfolded proteins, to remind you guys. They're misfolded in a way that favors that configuration. So those misfolded guys come around, cause the normal functional protein to misfold, and then it just spreads like a cascade after that. These cause diseases that we call spongiform encephalopathies. It causes sponge-like holes in the brain because the misfolded proteins aggregate together, and then this leads to neurological effects. Again, subacute encephalitis, it's a slow progression. Typically, we do not see signs or symptoms of this for 30 years. And then after 30 years, we start having progression over a year. Typically, once we have signs or symptoms of the spongiform encephalopathy, within a year of starting the signs or symptoms, you will die. This is a 100% fatality rate. There's no treatment for this whatsoever. Nobody survives this. So the diseases associated with prions: Creutzfeldt-Jakob disease, Gerstmann-Streusler-Scheinker disease. I don't know anything about that one. I haven't looked it up either. Kuru, which is a disease that's transmitted between cannibal populations of Papua New Guinea. They would eat their dead to venerate their dead and then become one with their dead. It was a very, it's a spiritual thing, yes. And so I feel like I understand that concept, right? We can see like wanting to be one with your lost loved ones, and that was part of the practice. They don't do it anymore because of Kuru, but they've been educated about it. So whatever. And then fatal familial insomnia. This is a genetically related one that you would know if it was running in your family. But people will die in adulthood because they cannot sleep anymore, because proteins that are involved in regulating their sleep cycle, they literally can't sleep. So they fall into a coma because of lack of sleep and what you need from sleep and to regenerating your body. They literally can't. It doesn't matter how tired they get. They're incapable of it at some point. So they would die from that. Yeah, that would be like horrifying to think about. But Creutzfeldt-Jakob disease is the more common one. It's usually genetically related, but you can also have a variant version of it where you could have eaten contaminated meat like beef, and then that can cause human proteins to misfold from seeing the misfolded cow proteins. That is a variant version of CJD that we call like mad cow disease. So again, misfolded proteins that we think causes the healthy versions to misfold just because of the configuration. And then those misfolded proteins build up and form holes in the brain. These are spread either by eating contaminated meat or using contaminated medical instruments. And so the problem with this is we autoclave our medical instruments, right, to make sure they're sterile. We autoclave our medical instruments for like 20 minutes at 121 degrees Celsius at like 15 PSI. That's great. Doesn't get rid of prions. Doesn't get rid of prions. Yes, because it's just a misfolded protein. So in order to get rid of prions, we have to treat the instruments with sodium hydroxide and autoclave them at 135 degrees Fahrenheit or Celsius. We don't do that. That's not anything that's done in medical practices. So if we suspect, and this has happened before, since I worked at Southwest Integris, we had 2 instances where we tested cerebrospinal fluid for prions. And so we can't test it in our facilities. We have to send it off to like Los Alamos or the CDC where they can test it. But we would just preparing those samples. We had all these procedures that we had to go through. We had to like increase the temperature and the pressure of the autoclave. We had to treat everything with sodium hydroxide. We had like special area that we only can use, all this like big old thing. So it's not common to have this, but there is a risk of it being transmitted through. There's actually been proven that it can be transmitted through like dental instruments and things like that. So okay. Here's some images of the holes in the brain that's the spongiform encephalopathy. This is not diagnosed until typically we will only diagnose this after death. That's the most common way to diagnose it. If we're trying to test for it in the cerebrospinal fluid, we are talking like thousands of dollars just to test for it in that situation. It's extremely uncommon and whatever. And the signs and symptoms of this, again, you would have been exposed to the protein maybe 30 years prior. And then 30 years later, now you're getting dementia. And so what are we going to think you have? Probably like Alzheimer's or just dementia. And like, so that is usually what it's going to be diagnosed as, unless we can't think of any other reason. And we have our last 2 diseases, which is going to be tetanus and botulism. Both of these are caused by the bacteria that are in the genera Clostridium. So these are endospore forming gram-positive rods that form endospores, hardy structures to resist the environment. So what happens, these guys have to get deep into the tissues to be able to cause the disease, or in the case of botulism, they're growing in the can in an anaerobic environment, and the toxins are what are going to make you sick. So in the case of tetanus, tetanospasmin is the neurotoxin, and what happens is it affects the peripheral nervous system and prevents you from relaxing. So you'll tense up a muscle, and it is done. Like it's stuck like that forever. And so it causes lockjaw. You'll tense the jaw, and it just stays like that. You can't open it. But it doesn't just cause that, guys. It progresses throughout the entire body. So most people will die from this because the diaphragm will be paralyzed. There are treatments that we can use to relax muscles like clonazepam and things like that, but more or less, this is like a wait and hope that this person works the toxin out of their body while you're trying to treat the infection that is causing the production of the toxin. And so it's extremely difficult to control this. This is a spastic paralysis. You're spasming the muscles and they're staying that way, versus in botulism where we have the flaccid paralysis. So in areas like underdeveloped countries or developing countries where we are having childbirth in the environment and it might be unclean, the endospores can cause infection in babies, and then they can have this be deadly. People who have tetanus, when their back muscles spasm like that, it can actually break their spine. So it can be very serious. Vaccine. All right, next, botulism. The toxin here is called botulinum toxin. We know that it's used to cause flaccid paralysis. So here is like you can't contract. In tetanus, you can't relax. In botulism, you can't contract. And so what happens is the botulinum toxin blocks the release of acetylcholine between your nerves. And so we can't send the signal to contract here. And so that's how botulinum toxin works. That's a flaccid paralysis. There's three major forms: foodborne, where you're ingesting food that has the toxin in it; infant botulism, where the infant might be exposed to the botulism toxin either in milk products or from the environment, causing infection and when it gets into the gut of babies. And then we have wound botulism, where we have deep wounds where the bacteria and endospores can become vegetative and create that. So that's it. I'm not going to go over the questions. Please feel free to go over the questions yourself in your own time. They're pretty straightforward. And let me know if you have any questions. We're going to head out to the lab. It'll be a quick, easy day in lab today. Yay.